Our presentation is the interprofessional approach to asthma management through telehealth. My name is Elise Grabowski, and I'm a dental medicine student.
I'm Bree Detty, and I'm a medical student.
I'm Sarah Lucas, and I'm a nursing student.
I'm Dorina Shannon, and I'm a dietetic student.
I'm Kylie Yoshikawa, and I'm a physical therapy student.
Charlotte Soto is a 6-year-old who has been suffering from allergen-induced asthma since she was 4. She lives with her mother, father, and younger brother, who all recently moved to an old 2-bedroom home in a remote rural region. Our interdisciplinary team's goal was to address Charlotte's case with a patient-centered approach where we used active listening, motivational interviewing, communication, and educational skills to work through the different social determinants of health.
Common environmental factors associated with asthma triggers are air quality, pollutants, and allergens. Other triggers may be physical activity, respiratory infections, and emotional stress. Prevention and minimizing exposure to asthma triggers can contribute to a decrease in the frequency and severity of asthma exacerbations.
Prior to our visit with Charlotte, she received her medical care through urgent care visits with limited continuity of care. She had difficulty attending in-person visits, and the closest pharmacy was 30 minutes away. Telehealth became a useful tool for managing her care. Although it came with its own challenges, Charlotte's parents were able to meet with a team of experts, and we used a patient-centered approach. Our social worker was also an incredible asset for building patient rapport and identifying resources.
Medical appointments and medication are known to be expensive, but everything else is often overlooked, such as insurance, commuting expenses, internet, and home modifications. The cost varies from patient to patient because some patients might have to spend more in one area than the other based on living situation, severity of asthma, and levels of access.
An important step is connecting to her school nurse to ensure her care plan is being adequately implemented and to advocate for Charlotte. Another concern is the family's lack of support. To address this, we would connect Charlotte's family to support groups and therapists. To support Charlotte's mental health, we would like to help her focus on alternative activities she can participate in despite her asthma.
Charlotte's parents must actively contribute to her healthcare. The family has difficulty understanding medication administration, function, and side effects. The mother's concerns made it evident that the family needed education on disease management and medication options that are pertinent to their daughter. We established Charlotte's medication protocol, gave oral hygiene and dietary guidance, and provided reassurance.
To conclude, social determinants of health were found to be important factors in asthma management in the interprofessional case. A care plan worked towards improving access to healthcare, reducing exposure to environmental factors, educating the patient and family, minimizing finances, and offering social support. These are our references. Any questions?
Okay, well, we are ready for any questions. We can close down and open the floor to some questions. And I would love folks who were whose presentation was to introduce yourselves. Unmute yourselves and introduce yourselves to the group. And let's see who are members of the team. I know, Elise, you were there. So please introduce yourselves, and then we'll start asking a few questions.
Hi, I'm Elise. I'm a 4th-year dental student.
Hi, everyone. I'm Dorina Shannon. I'm a first-year grad student with the dietetics program at UNE.
I'm Kylie, and I am a second-year physical therapy student at UNE.
I'm Sarah, and I'm a nursing student at UNE.
So I have a bunch of questions, but I'd rather open the floor to you to see if anybody would like to ask this team some questions. All righty, then I will start. So I'm really interested about your takeaways, what you learn about and from each other. I noticed that you mentioned social work in there and the function of social work, but what did you really learn from each other in working with a case that involved a child with asthma and the needs of her family?
I think we learned to be good listeners, first and foremost. I think when we were meeting ahead of time, we had a very structured agenda of the questions we wanted to ask and what we wanted to find out from the patient's family. However, when we actually met with mom during the first meeting and then dad in the second meeting, it became very clear that we needed to restructure ourselves and just sit back and listen to what the parents had to say. So it took some patience and it took flexibility on our part to adjust and see, depending on what we hear, how we can best provide patient-centered care, depending on what the most pertinent issues and needs for that family were.
Great. So really learning from the patients about what their needs were was a really critical step. Anyone else want to comment on one of your takeaways or what you learned about each other?
I think also just finding the balance, because we each have our own profession and we have so much to add to this patient case, but then finding the balance of what we can contribute and things that maybe we can pull back a little bit so our other teammates can also add what they have to contribute.
I love that. That was great.
Can I ask a question?
Yeah.
So I'm just curious, what surprised you the most about this, about your work in the simulation with this family, or about the teamwork?
I can answer that, I guess. I think my biggest surprise was that the roles of each healthcare provider weren't as clear cut as I initially would have thought. I initially kind of thought it would be like each area of medicine would kind of apply to one profession and it would all work together like that. But it was more interconnected and everyone was kind of working together and everyone had something to say on each point from like a slightly different perspective. So it's much more flexible than I initially expected in the teamwork aspect.
Thanks, Sarah. Anyone else want to speak to that?
I also found that some of the different programs and disciplines overlapped, like nutrition and dental were very similar.
Yeah, I'm really interested in the dental aspect of this case because I actually helped develop the case, and I'm interested in what, from an oral health perspective, you might have taken away.
Yeah, it's definitely really important that the patient understands the side effects of certain medications and different ways to prevent possibly other conditions that could be caused from medications.
Yeah, and the family really didn't know that. So really important learning. Okay, well, I have more. What was the hardest thing? What was the hardest part of doing this together? Because everyone thinks, you've been on a team, you played a sport, or you've been part of a debate society, or, what was the hardest part for you?
I would say time management. There was such a short amount of time for each scenario. It was really difficult for us to fit in everything that we wanted to within that amount of time.
And for me, I would say the hardest thing was trying to find my role as a dietitian in that case and how I could be best helpful, given all the things that are going on in that family's life, how what I have to say could be useful and applicable to Charlotte.
So, Dorina, what did you find out was, because nutrition seems to be critically important in this family's situation. What did you find out your role was?
Yeah, so I came in very determined that the family could be greatly helped by, giving some ideas and thoughts about, smaller meals, more frequent meals, increasing vitamin D, magnesium. However, as I was ready to deliver that big spiel, it seemed like the family had a change of heart, or they wanted to shift direction. So that definitely caught me off guard. And I wasn't able to say all that I wanted to say, but I had to check myself and realize that if that's not what the family wants to hear, and if they're hearing, I think part of the issue was because of all those different difficult situations they were going through, they didn't see my role as somebody who's there to help. They saw me as somebody who was there to judge the way they were feeding their daughter. So that's when I had to kind of shift gear and pass it on to Elise to talk about, oral health and focus more on that instead of what Charlotte's actually eating. So to me, that was difficult to do.
Yeah. So adaptability. I've just been told that it's time to move on. Thank you so much for your team work. You did a great job. Thanks so much.
Our next presentation is from folks who participated in the Ghana cross-cultural immersion.
Hello, I'm Allison, and today I'm happy. Hello, I'm Allison, and today I'm happy to, alongside my team member, share our transformative service learning experience as part of the UNE cross-cultural exchange program. Our student team consists of myself, representing the public health program, Emmy from nursing, and Kayla from osteopathic medicine. As part of a larger interdisciplinary team from UNE, our journey took us to Sekani Takoradi in Ghana. Together, we collaborated with local community members and healthcare workers, working hand in hand to establish and operate pop-up health clinics. In our collaborative efforts, we reached hundreds of patients across 3 communities, including conducting health screenings, providing medications, and consultations with various clinicians. Here's a snapshot from one of those clinics. Beyond clinical aspects, our team embodied core teamwork principles, including flexibility, respect for diverse perspectives, and problem solving, and a readiness to enhance the organization and, most importantly, improve patient care.
So using effective communication was not only critical in making our workspace more efficient, but also providing patient education is of the utmost importance in medicine. During our time in Ghana, I was primarily working with an optometrist. I was surprised when I met a 14-year-old girl who was developing cataracts, as this is a disease that typically affects older adults and sometimes infants in congenital cases. With a translator, I asked the child and her grandfather about her condition. They had seen a doctor a couple months prior, and they were told that she needed surgery. Her grandfather asked me if it would be possible to get glasses for her instead. I asked them about their hesitations with surgery, as I explained that this was the only way that her eye could be saved and that glasses would not prevent the damage that was occurring to her eye as the cataract developed. It was not the cost of the surgery that was the deterrent, but rather when the family was told that she needed surgery, they weren't given sufficient patient education. They are under the impression that her eye would be physically removed from her head and then reimplanted during surgery. We explained that this wasn't the case, and that although with every surgery there are risks, that the risks were minimal in this case. The child and her grandfather were appreciative and thrilled to receive more information about her situation, and actually ended up calling their local hospital then and there to make an appointment. I'm so grateful to have been a part of this experience, as it demonstrated just how important it is to meet patients and their families where they're at and confirm understanding.
Our biggest barrier that we faced while in Ghana was the communication barrier between us and our patients. We had incredible translators to help us with this, but not enough of them to go around, and so we had to get creative in order to ensure that all our patients were receiving the best possible care. Since participating in this program, I've been thinking a lot about ways to enhance the efficiency of our clinic and to keep our role going as healthcare advocates by educating the next group of students that attend on what went wrong and what went right, so they can learn from our mistakes. We moved things around at the clinic nearly every day in order to create the most efficient clinic we could. All of our roles and responsibilities melded together and created a type of teamwork that I've never experienced with other healthcare professionals. Our work is all intertwined. Hello, I'm Allison.
There are risks, and as it demonstrated just how important it is to meet patients and their families where they're at and
for them to go around. And so we had to get creative in order to ensure that all our patients were receiving the best possible care. Since participating in this program, I've been thinking a lot about ways to enhance the efficiency of our clinic and to keep our role going as healthcare advocates by educating the next group of students that attend on what went wrong and what went right, so they can learn from our mistakes. We moved things around at the clinic nearly every day in order to create the most efficient clinic we could. All of our roles and responsibilities melded together and created a type of teamwork that I've never experienced with other healthcare professionals. Our work is all intertwined, and by using our different healthcare experiences, we overcame any challenges by keeping an open mind and using collaborative communication and keeping our patients as the priority focus. Thank you, and we look forward to your questions.
Bravo. That was great. So
Sorry about the technical issue.
it happens. So can those of you who are part of this project introduce yourself, and then we'll open the floor to questions.
Hi, I'm Kayla, and I'm a second-year medical student.
Hi, I'm Allison, and I'm a student in the Master of Public Health program.
Hi, I'm Emmy, and I am a senior nursing student.
Wonderful. Wonderful. Well, I know for a fact that several of us have been on this journey to Ghana, and I would imagine that there are some questions out there. But I'll ask the first question, which is, what'd you learn from each other? And I love that you talked about it being a very different kind of teamwork and really learning and wanting to pass that on to the next group of students who go. So can you say a little bit about what you specifically learned about and from each other?
I can start. Something that I at first was a little intimidated by, but grew to really love and appreciate was I was the only medical student there. And there were so many different groups of so many people that had just fantastic different backgrounds and different perspectives. And something I really valued probably the most out of it was just seeing and talking with everyone and how to most efficiently set up the clinic so that we could see the most patients in the limited amount of time that we were there. And everyone had fantastic ideas and everyone was just so willing to learn and wanting to learn from each other. I think it made just an incredible experience out of it. So for example, Allison had a lot of surveys that I think we can talk about soon. But having her next to our intake station where we're taking vitals and just getting an assessment of how well English was understood due to a lack of translators, we could just immediately send over people who could understand English to Allison and other students performing surveys. So I really, really just enjoyed the openness and how everyone having different perspectives is just such a great way to make medicine work.
Yeah, I agree with Kayla. As a public health student and not necessarily a clinician, I wasn't sure about what our role was going to be. And it's hard to expect what it's going to be like going in, but it really impressed me about there was no like sense of something's below me. Everyone just jumped in whenever they needed to do. Even our faculty was amazing. I mean, they were in the same living conditions as us. They like were there every step of the way. So it was really amazing to see that everyone, no matter what their role, was willing to jump in whenever necessary or possible.
We have a question. Oh, go ahead. I'm sorry.
Sorry. Going off of that, one thing that stood out for me was the work that the social work master's students did when they went to the school systems, and we donated like a bunch of soccer balls and we donated a skeleton to one of the schools, and there were all kinds of like period packs for the students, and I just thought that work was super interesting and it was something that I hadn't really experienced before.
Sorry to interrupt you. There's a question in the chat from Dean Morton asking about what did you learn from your Ghanaian colleagues about teamwork?
I'll go first on that. So with me with public health, I was helping out wherever I could. And then I also did some surveys to understand more about malaria in the community. So I worked with interpreters, and it took maybe like the first couple of days of working with an interpreter to kind of like assess our roles. So I think at first it felt almost like they were like working for us, but I really wanted to break that down and like show that we're working as a team. And if they have suggestions on how to make this better, I was willing to hear it, not just hear like, we don't want to hear like, oh, you're doing a great job. We want to be told, what can we do better? How can we streamline this? How can we do better care? So I think it was great by the end. I think everyone was really on the same page about that.
There a multitude of them, but I think it's important for others to hear.
Something that I struggled with a little bit was kind of disregarding some medicine that I had learned as like a factual, like obviously there's black and white, like yes and no answers sometimes in medicine, but a lot of the time there's so many different ways of thinking about things, and accepting views, especially from like churches about medicine, and trying to integrate their strong beliefs and things that really keep them going while making sure that their health is also met, and respecting the patients along the way, but also just giving information that we learned as advice. Well, yeah, it was a balance.
Right. And I would just add that we follow the Ghana Health Service clinical practice guidelines over there. And so some of their evidence isn't necessarily our best evidence. So there's compromise, right. And we're guests.
And sadly,
so
we need to.
Really important. Yeah.
Sorry to interrupt you, Dean Morton, but we have to move on.
Oh, I'm sorry.
That's okay. Yeah. Thank you, everybody, for an amazing presentation, and we will go on to the next. We need a whole day for this.
Our topic is secondary transition resources across New England. A question that's often asked is what secondary transition programs exist in order for students' seamless integration into adulthood, equipping them with the tools to navigate the complexities of life beyond school. And this question was our foundation for figuring out what we wanted our project to be about. So my name is Hannah Laverty. I'm a junior health, wellness, and occupational studies major, and I have a special education minor. My name is Michaela O'Meara. I'm a senior health, wellness, and occupational studies major with a concentration in assistive technology. I'm Morgan Bassett. I'm a junior special education major and elementary education double. I'm Olivia Hand. I'm a junior special education major with a minor in mental health rehabilitation. Our faculty member is Karen Hussman. She's the associate clinical professor and director, Department of Health Promotion Studies, Health, Wellness, and Occupational Studies. So our objective for this project was the world of secondary transition can be overwhelming for families and students alike. Lots of individuals do not know where to start when it comes to resources available. This makes it difficult for them to utilize all of the services that they might have. Our website is important because it compiles a variety of resources in each New England state to make the process more digestible for those families and students affected by it. So our website is set up. So this is the homepage. It's a secondary transition resources. Each one of these boxes, Maine, New Hampshire, Vermont, Massachusetts, Connecticut, and Rhode Island are the states in New England. And they each link right to the pages. So then the links are also on the side. So you can reach any state, and then within each state, we focus it on the services provided in the state, employment resources, advocacy resources, transportation, health and wellness, housing, community, and funding. All those resources and each one of those links is included in each state. So then the state pages are set up similarly to our homepage, where each one of these buttons is a link right to the page. So if you click right on Rhode Island, you don't have to go down and click any of the side links. You can click them right from the homepage. And then each one of our state pages contains a little fact about individuals with disabilities in each state, and then it has a figure. And then each resource contains an icon or company logo, the name of the resource, easy access link, and a little description, a brief description of what the resource entails. And then the front page or the home page of each one of our states has all the resources, and then each link is divided into the resources for that. We've learned that when the resource is specifically important for individuals with disabilities as they transition through adulthood and independence are important, because when individuals transition from high school and living at home to obtaining their own residence and jobs, they're often a loss of supports and lack of information to learn about resources, and that can be overwhelming. And then the project relates to our interprofessional honors distinction because through teamwork, roles and responsibilities, and communication, and we utilize those things a lot through the creation of this project. By working together, we showed effective communication, role setting, and teamwork from the completion of our website.
Well, thank you. I want to take note that you are one of the few fully undergraduate presentations we have. So thank you so much for that. And would anyone introduce yourselves first, and so we can meet the team. And then we'll ask you some questions.
Hi, my name's Hannah. I'm a junior Hawass major.
Great.
I'm Michaela. I'm a senior Hawass major.
Nice.
I'm Morgan. I'm a junior special education and elementary education double major.
Great.
I'm Olivia, and I'm a special education major with a minor in mental health rehabilitation.
Nice. So wonderful to have you all here. And I'm going to wait and see if anyone else wants to ask a question, because we're getting shorter and shorter on time. Who has a question? Well, I guess I will ask a question, and I seem to be a lead on this. So what you learn from each other? What you're working together as an interprofessional team. This is an amazing project, and a really, really useful project. But I'm interested in what you learned from each other, and what was hard. Was there anything that was hard?
I'll go first. So I think I really learned a lot from this project. We actually started it we were trying to figure out, we think it was really early last spring semester. And it basically, the hardest part for us, I think, was just coming up with a timeline. We had like a really strong idea of what we wanted to create, and just the aspect of actually putting it into a physical form was probably just that big transition that we had to make. But working together with everyone was really good and easy. We all had very different perspectives that we came from that honestly really seamlessly overlapped, which was really great, especially with working on this project. Yeah.
I can jump in too. I would say learning from each other. I think it really helped deciding what kind of resources we were going to include in our website, just because I feel like from the educational standpoint, I was looking more towards, educational, secondary education, maybe college opportunities, but then the HOAS majors kind of brought in those extra pieces of information that maybe I wouldn't have thought about. So that was really helpful to kind of have all of our expertise put together into one.
So, Steve, you had a question in the chat. Would you like to ask it?
Sorry about that. Yeah, I just am interested in knowing whether or how your interdisciplinary team involvement may have changed your career paths.
I think for me, maybe it didn't necessarily change my career path or what I wanted to do, but it really opened my eyes up to the way that I know now that I can work with people in other professions, like for the HOAS majors, maybe if they're going into OT or PT, I've learned how they have a very different perspective, and that could be really valuable for making goals for my students in the future.
Yeah, I would agree with Olivia. I think that through working with special education majors, I think I realized that we kind of all have the student in mind when we're working with them as practitioners in a school. And I think that was really important. And I think that would maybe change how I practice in the future.
Well, yeah, I mean, the other thing that really came through for me in watching you do this process is the passion you had for helping with people with disabilities to transition into adulthood or into next steps after school. So I just wonder if you learned anything about that further, or learned how you could work together to accomplish a seamless transition.
I think as far as finding resources go, I think that there's way more out there than I had originally thought that there were. And so I think it was really important to kind of compile them all in one place to kind of ease that process for a lot of people.
I think I definitely knew that what to do, parts of what to do to help a student transition outside of high school, going into an independent lifestyle, but I didn't know there were so many resources out there. And I think probably a lot of other people don't know about that too, which is why the website will be really useful for them.
I was just going to add also that as an education major, I don't think that I always considered that OT or PT or those other specialties in the school system could help with a situation like this. So I think it was really helpful to open my eyes that, those people in my future career in the school system, I can reach out to help. And they will have ideas as well. And it's not all on the teacher to help the student.
Something I just want to add about that. I'm going to add the link to our website into the chat of this meeting, so that if you guys all want to take the time to look at it, we'd really greatly appreciate that. It's honestly a great resource, and there are so much more out there. But we took the time and we found as many as we could. Kind of like everyone's been saying, there's so many out there that we didn't even realize could be out there, especially from that last year of the school district to that first year of no longer having those kind of supports that the town or district put in place. That big transition from having a lot of supports to not having those directly given to you is a big change. And this was kind of our way of trying to bridge that gap. So I'm going to add that.
Thank you. That's wonderful. It's not a population that people think about as much as they should in the transition from being in an elementary or high school situation to being out in the big world. So you're advancing knowledge and resources, and that's absolutely fantastic. Anyone else have questions? I know, Kelly, we have about a minute? 1 minute. Who would love to have that 1 minute? Anything the team would like to say that we haven't covered yet? One last remark from you folks about what was the best thing about this project?
I think for me, the best part about doing this project was knowing that I'm helping adults and maybe parents of children with disabilities have a resource to go to if they need help with the transition, which just feels really good.
Well, that's a great final comment. Thank you so much, team. You did a fabulous job on a very important area. Thank you, and can't wait to see what you're going to do next.
Today I'm going to be presenting on a case study on type 2 diabetes. Bob Murphy is a 65-year-old retired truck driver from Millinocket, Maine, and he came to the office complaining of trouble with his vision and had a tingling feeling in his feet that have made him feel unsteady. Bob has worked as a cross-country truck driver for the past 40 years and mentioned that he was diagnosed with type 2 diabetes 5 years ago while on the road, but has not been able to change his fast food diet or sedentary lifestyle due to the demands of the job. This is the first time he is seeking care since that diagnosis and since from retiring from trucking last year. Now that he's retired, Bob has been able to play more golf with his friends, but still struggles to improve his fast food and 4 beers a night diet. Bob says that he does not understand what having diabetes means and has thought that his symptoms were related to his older age. He wants to know what he can do so that he can continue to golf with his friends. This is a framework that looks at all the aspects from Bob's life in the health and behavioral factors to the demographic and socioeconomic influences. Some of these factors, such as his diet and lack of understanding his diagnosis, are directly feeding into his uncontrolled diabetes, while others, such as having health insurance, a stable housing environment, and better exercise routine, reduce the risk of diabetes progressing. Working with Bob, we hope to provide interventions and a treatment plan that aim to expand upon the factors that reduce his diabetes progression while lessening the factors that promote his diabetes. The interventions and resources we provide Bob are to help and support and educate him about his type 2 diabetes, about the symptoms and what he can do to slow the disease progression. Thrive Penobscot is an organization that is based out of Millinocket, Maine. Their goal is to provide a host of resources to older individuals suffering from chronic diseases. They also have many transportation services, in-house assistance and support, food resources, and they also help with scheduling medical appointments. Through his Medicare plan, Bob would qualify and benefit from this resource. Additionally, we would have him enrolled in the diabetes education program at Millinocket Regional Hospital, where a diabetes nurse educator and dietitian would help Bob one-on-one to manage his diabetes while creating a diet plan to help him with what food to incorporate or reduce in his diet. In addition to these programs, we want to emphasize the importance of exercise in reducing the symptoms and progression of type 2 diabetes. Bob, in addition to golfing, can also start to utilize nearby trails in the Katahdin Pride Park or Kermit Crandall Park. Bob can also get senior discounts at the local YMCA and Medway Recreational Complex, which offer a host of low-impact classes. These are just a few of the many resources and ideas we have lined up for Bob. We hope to continue offering these to him in future follow-up visits to support him in adapting a healthier lifestyle in order to manage his diabetes so that he can continue to do the activities he loves with friends.
Okay, well, thank you for that. And who are the members of the team who are here from this project? And this is a FIT project. So can you introduce yourself?
Yeah, my name is Aiden Regan. I am a first-year pharmacy student.
Welcome, Aiden. And who else is here?
And I'm here as well. I'm Maddie Powers. I'm a second-year comm student right now. And then who you guys heard talking through the project was our third team member, David, who won't be here today. But...
Okay, great. Well, I'd like to start with maybe asking you a little bit about your paradigm, because it's very clear you have a model that you're working from. So it would be really helpful, I think, for all of us to know a little bit more about that and how it intersects with interprofessional working and practice.
Yeah, definitely. I mean, so we all we're a part of the PHIT program. And so our assignment basically for this semester was to create a case from scratch and to kind of make it a personable experience that we're kind of creating this person and we're deciding what resources they have as well as kind of what's going on with them in terms of disease progression. And I really enjoyed kind of doing this project. Sorry for the background noise. I'm at a cafe that I just got to. But I really enjoyed it because they pushed us to go beyond pharmaceuticals, which I think is always kind of medicine's first line and to really kind of delve into like what is going on with this man beyond medicine and what is his social life, what is his environment like. So that's kind of why we approached our interventions in a more holistic way, in a less pharmaceutical way, as to give him resources that can actually work for him in his environment that he is in.
Yeah, I liked how we considered all the factors in his life, not just like what kind of medications he has to take. I think when you consider all the factors, you can help people a lot more.
So Aiden, as a pharmacy student, was that a challenge?
Oh yeah, it was definitely still a challenge. I mean, I'm still very new to healthcare. I was a math major in my undergrad, so I'm kind of learning as I go. But yeah, it was definitely challenging.
Great.
I'm just curious, who do you think was missing from your team? You know, what other provider would you have liked to have to consult with around this case?
Yeah, definitely. I think this was actually something we brought up to our leader, and that we would have loved to have some type of social worker, dietitian, just another grad student that maybe has more of that, not even perspective, but also like resources that they could help us with. Because in the end, what we did was kind of broke it up with each other, and we're like, what programs can we find that are all encompassing for this patient that we've created? And like we did find really great resources that I honestly had no idea even existed. And it's that Thrive Penobscot program would have really encompassed all of this gentleman's problems and been a resource and support for him. But I think, yeah, even having like nursing perspectives, social care perspectives, I think would have helped us just kind of have a better perspective as to what other resources can be out there for patients that we'd be seeing in the office.
I was surprised at how many resources there were available to him despite the rural area that he lives in.
Which is really important. And also sometimes in rural areas, of course, there's a challenge to finding those kinds of resources. So I want to build on your comment, Maddie, and say and ask you, before you did this project, would you have thought in this kind of broader other professional kind of way, or was this project instrumental in shifting your paradigm?
I think I've had a unique experience where I had some time in between undergrad and medical school, and I also minored in anthropology, specifically medical anthropology, where we got that idea of like caring for a human beyond what medicine dictates. So I knew I wanted to get involved with this interprofessional project to see what other resources like those dietitians or social workers had in their back pockets. And of course, kind of ended up with 2 medical students and a farm student. But again, like I think having that on us to actually go out and search for actual realistic resources, that's what kind of expanded my knowledge as to what's available for patients beyond what I can do myself. And that emphasis of like collaboration amongst, different interprofessional roles. But it was very interesting to kind of delve deep and really find those resources for this patient.
Yeah, I agree with everything Maddie said. It was a fun experience.
So Christina, I see you had a question in the chat. Would you like to ask or at least you have a comment in the chat. Would you like to ask it or say it?
Hi. Yeah, no, honestly, I was just commenting, Aiden, you were referring to other factors that contribute to overall care and how you might advise or make recommendations. And as a public health practitioner, I can say that this is the whole point, right? And I think often we're not reminded of the importance of bringing in this piece into the clinical atmosphere. And it really is something that we need to be thinking about when we give overall patient care and how we use social determinants of health and other aspects and factors into making recommendations, particularly those that are sustainable for medication needs, dietary needs, et cetera.
I was thinking about what Aiden talked about working in a rural community, and I was wondering if that was particularly salient for you in this project, or what you learned from thinking about resources in a rural community.
So you're asking if that's something I might consider doing in my future? Was that the question?
Perhaps, I guess the question was more, well, many of our students aren't from rural communities, so thinking about accessing healthcare in a rural community, but did you learn anything from that aspect of the case?
Well, like I said before, I learned that, I mean, at least in Millinocket, where this gentleman lives, there are a lot of resources, even if we don't think there are. Like it's easier to find help than people might think.
Maybe, you know, we have assumptions that need to be examined, right? Before we, you know, we need to discover what's out there. Maddie, did you want to add something?
Yeah, I just wanted to say, so like I actually chose the setting of Millinocket because I'm from Massachusetts, Boston area, which is, you know, polar opposite. And some of my classmates up here were saying that they lived in Millinocket without, you know, electricity for a long time. And so that was why I was like, wanted to pose this as a challenge for us to put this guy in what we think to be a rural community, but also see that once we delve into this rural community of Millinocket, Maine, that there are resources out there for this specific gentleman, which I think is beyond necessary, because that Thrive Penobscot program we had mentioned as like a interventional care, like their number one goal is to provide resources, whether that be from food to shopping to getting to your healthcare appointments to getting a good diet, all with the goal of helping, you know, older folks in the community with a chronic progressive disease, which was like very exciting to see that that was a program. And I wish that was like even more outspoken in cities. So that was a really interesting thing for us to kind of have this Millinocket setting, but then delve really deep into the actual resources there and see that there are things that we can be giving patients beyond just our care in office, as well as, you know, educating the patient as to the resources they can access themselves and what they can be doing on their own time, type of thing.
So we have about, what, a minute or 1 minute to go, and then the final slide. If you can say in 1 minute, how did you come to develop your case? And did you do it together collaboratively, the three of you?
Yeah, this has kind of been going on the whole semester, and it just kind of started with what's your case, who's your person, what disease do they have, and then after meeting and meeting, where it's like, let's find actual resources. So it was a great experience, I think, and I think we've all learned a lot, not only just working on this case, but like working together across interprofessional roles, as well as like divvying up team responsibilities. So it was a great experience through and through.
So Kelly, did you want to add anything?
So I just wanted to mention that I have dropped in the chat a couple of times the QR code and the link to please go follow that link and record your attendance at this event. It can count toward your IP distinctions, honors distinction application.
Well, thank you both, and thank you all of you who have hung in here for this whole time. You students, you were amazing, absolutely amazing, and it makes me feel very hopeful for the healthcare of the future, and we wish you all the best.
Thank you guys so much.
Thank you.